baby, who's not really a baby, is toilet trained. He knows when he needs to go to the toilet and makes it there in time, well, most of the time, and at night he stays dry. I've been leaving a diaper on him, but right now there really is no need. And after doing all that hard work and trying to be patient, and all the times I wanted to pull out my hair, oh, what a relief. No more slipping in unknown puddles around the house. You know, sometimes it feels like having another grown-up in the house. It's a lovely feeling of life moving forward and passing the baby stage, and presumably a stress-free period of time. But then, just a couple of weeks ago, he complained of stomach pain. At first, I thought he had a stomach virus, but then I noticed that he hadn't had a bowel movement for a couple of days. Each day, when pain started, he would sit on the toilet, stiff and tense, afraid of relaxing and literally letting go. The fear of rectal pain was so great that he refused to make a bowel movement for a week. How is it possible not to go to the toilet for a week? Fear can do it. It's a great motivator not to go to the toilet. There are different reasons why children become constipated through fear. I'm no psychologist, and the examples brought to you are from my observations and experiences over the years. Why is a child afraid to make a bowel movement? Is his fear emotional, or does it come from the actual experience of physical pain? Hi, I'm Barbara Fearer, founder of thelisteningtouch.com, teaching mums how to calm their children with light touch techniques. A number of years ago, my 4-year-old client went through a period of emotional fear when it came to passing stool. This fear arose from the fact that his mother was pregnant and he just knew that she would leave him suddenly and without warning to go to the hospital. He was scared and tense, waiting for this to happen. Why was this scenario stuck in his thoughts? It all started when Nate was 2.5 years old. Since his mother was due to give birth in the following few months, his parents decided to hold off on his toilet training since it would require a lot of energy and patience, which they did not have in abundance at the time. At the same time, Nate didn't have much interest in being toilet trained. He was much more excited about gaining a baby sister. This was a huge event in his life. Then, without warning, his mother, who had been 6.5 months pregnant, suddenly went into labor. She was hospitalized but gave birth almost a week later. Then there was the marathon of his parents running back and forth to the hospital, burdened with the natural worries of having a premature baby, and at the end of the day, racing back home so that Nate wouldn't feel neglected. During this difficult time, Nate was taken good care of by 2 sets of loving grandparents, but this period in his short life affected him emotionally, creating fear that his mother would leave again. But this fear only showed up when his mother was due to give birth to her 3rd child a 1.5 years later. By then, Nate was 4 years old and toilet trained. This time, the labor and birth went without a hitch. The baby was born on time and both mum and baby returned from hospital after 2 nights. Everything seemed normal. But as the family settled into some type of routine, Nate refused to go to the toilet. He also refused to leave his mother when he was taken to kindergarten, or anywhere else for that matter. The same applied when his mother needed to be somewhere. After a visit to the doctor to discuss this situation, it was concluded that Nate had an emotional fear of letting go of his mother. This in turn was presented as fear of letting go of his stool. The problem that this creates is that the longer one has constipation, the harder the stool becomes. This is followed by rectal pain, a physical pain in the area where the stool is discharged, since it is difficult to pass the stool. This not letting go also caused severe stomach cramps. Today's story is about an emotional situation which becomes physical, resulting in painful constipation. There are other, less serious but common situations where constipation develops. For instance, a child may not want to interrupt his playtime, or it may be too much of an effort to go to the toilet. Another aspect is that he may not be eating enough fiber readily available in fruits and vegetables, or drinking enough fluids like water. To help your child relax and open himself to having a bowel movement, I'm focusing on the solution and not the reason that he has constipation. In other words, how to place your hands on your child for his relief. The following technique is used to gently loosen the body and allow the stool to pass. Place your hand on his lower back close to his tailbone. This works especially well when he's sitting on the toilet with his feet on a stool. Speak softly with calming words of encouragement, helping his mind and body relax. These words should not be conditional, like saying, "I'll buy you that big football you want if you just make." On the other hand, words may not be necessary when you feel your child relax beneath your hand. The hand placement here is very simple. You just leave your hand resting on his lower back. If he's uncomfortable with this, you can hold your hand above the area. These following pictures show just how natural this process can be. Mum's hand is resting on her child's side with the fingers resting on the lower back. This photo shows Mum's hands directly over the tailbone with the palm resting on the lower back. These two positions can be done when your child is in pain or just wants relief and wants to go to the toilet. You can do this while you're giving him a hug. I couldn't resist adding this picture. Although we're discussing older kids and not toddlers, this scenario captures the natural and loving way Mum is resting her hand on her child's back, smiling her encouragement and just being. Now we're going to delve a little deeper in providing relief for your child. While your hands are placed in their position that is comfortable for both of you, focus on using your imagination. This plays an important role. You can imagine the stool as gentle waves flowing through the passageway of the intestines down to the anus and out of the body. Repeat the process as many times as you see fit until you feel your child's body loosening and he wants to expel the stool. Although this thought process may seem icky, this detailed use of your imagination will relieve your child of constipation. This method may seem weird and feel a bit strange in using your imagination to relieve pain, but believe in yourself and believe in the power of healing hands and mind. This may take some time to get used to, but it really works when you feel confident in taking charge of finding different ways to relieve your child's discomfort. This does not negate the need for your doctor if necessary. Whenever you feel the need to see your healthcare professional, don't hesitate. But having these listening touch tools will make your life a lot easier and calmer. For more information on the listening touch, sign up to receive a free chapter of my book, The 5 Keys to Calming Your Baby. The techniques shown in the book are also relevant for toddlers and older children. The link is in the description below this video. I'm Barbara Fira, wishing you a super calm day.